You're live. All right, good morning. It's Friday, the 13th, which is a good news and a bad news, because tomorrow is Valentine's Day. That makes it the good news. And this is Senate Health and Welfare. We're going to take up, Katie, we'll go right to H 545. Oh, I lost all my committee tabs. Yeah. Yeah. Okay. No, I found it. Okay.
Good morning,
Good morning.
Katie McDonough, Office of Legislative Counsel. Let me share our latest draft. Oops, I need sharing permission. Let's check it out.
Fine tuning this for us, which is great.
Okay. There we go. 545. This is draft 2.1. This is the same version that you have last looked at. If you remember, we had looked at instances of amendment. The committee asked for it to be part of a strike all. So now the amendments from OPR that you looked at as instances are integrated into this draft. How would you like to proceed? Would you like me to
Let's go through the
review
draft.
with you?
Yep, and see where it is, and then I think once that happens, we'll be able to decide when to vote on the bill.
Okay. So if you remember, the first half of the bill takes effect on passage and is effective through July 1, 2031. You have section 18 VSA 1130. This is amending existing law that sets up the Department of Health's immunization program. The really biggest change in this section is changing the definition of immunization to be recommended immunization, which means immunizations that are recommended by the Commissioner of Health instead of linked to the CDC recommendations. This section also allows the Department of Health to purchase immunizations outside of CDC with a different vendor. And you have some language that updates how appointments are made for the Immunization Funding Advisory Committee. Those changes, well, here they are. These changes stay in effect after the July 1, 2031 date with regard to the appointments of this advisory council. Okay, I'm gonna skip ahead. Section 2 is the recommended immunization section. This is a new section that will sunset on July 1, 2031. In subsection A, you lay out the parameters that the commissioner can make recommendations on, and the consultation from the, sorry, I'm getting a lot of email pop-ups. Subsection B is giving some guidance about who the commissioner has to consult with prior to making recommendations. So we know the commissioner has to consult with the Vermont Immunization Advisory Council, and the commissioner also has to consider recommendations from various professional organizations, including CDC. Subsection C is the liability language with regard to civil and administrative liability for healthcare professionals acting within the commissioner's recommendations. Subsection D allows a standing order for immunizations that are recommended by the commissioner. Subsection E has to do with displaying information related to recommended immunizations on the department's website. And also in subdivision E2, requiring the department to note when there are recommended immunizations that differed for some reason from the recommendations of the Immunization Advisory Council. Section 3, this is the Vermont Immunization Advisory Council. This updates the membership of the council. And as we have mentioned before, these updates would exist beyond the July 1, 2031 date, this would be a ongoing change. And subsection C, this draft updates the language of regarding the responsibilities of the council to include advice on recommended immunizations. It also specifies that the Secretary of Education or the Secretary's designee and the representative of public schools, those two individuals are not voting on the recommended immunizations. And then we get to section 4. Section 4 and 5 are health insurance sections. Currently, coverage is linked to CDC recommendations. So this language instead links to the commissioner's recommendations with regard to coverage for immunizations. So that's section 4 and 5. That brings us to sections 6 and 7. 6 is pertains to pharmacists, 7 pertains to pharmacy techs. The authority to prescribe, order, and administer immunizations is currently tied to the CDC. So the change here is to instead be tied to recommendations of the commissioner for that authority. Same thing for patients 5 or older receiving a flu or COVID immunizations. Section 7. This was one of your instances of amendment coming from OPR. There's some reorganization going, but the change was the authority for pharmacy techs to administer immunizations, which is subdivision 2. So pharmacy technicians shall only administer immunizations when a licensed pharmacist who is trained to immunize is present and able to assist with the immunization as needed, pursuant to valid prescription by a practitioner, or a standing order made by the Commissioner of Health, or a protocol approved by the Commissioner of Health under subdivision 2023 B2A. That is the previous section. So it's referring back to the pharmacist authority. To patients who are 18 years of age or older, and to patients that are 5 years of age or older seeking the flu and immunization, vaccines or subsequent formulations. And just as a reminder, this would also be ongoing law. So this would not revert back as of July 1, 2031. Okay. So that brings us to the halfway point in the bill. What happens at that point is that language starts to go back in place to sort of return to the status quo. So in section 8, we're returning to the definition of immunization, again, with this additional language being retained that it includes other immunizing agents, but the link is to CDC and no longer to the commissioner's recommended immunizations. These ellipses, we've already talked about this, but when you see the ellipses, we're retaining existing law. So this is the Department of Health's immunization program. Most of the changes are using the definition of immunization instead of recommended immunization. This is all going back to current status quo. This is what I was looking for. Immunization Funding Advisory Committee, we already said that, but the appointments are going to be the same moving forward. So that's what these ellipses mean at the top of page 18, that language will not change as of July 1, 2031. Okay, section 9 is the Vermont Immunization Advisory Council, and we have the same thing happening here with these ellipses, that because we're showing ellipses and not subsection B, we're retaining the changes to the membership of that committee that were made in section 3 of the bill. But the duties do revert back, meaning that this committee would no longer give advice to the commissioner on recommended immunizations. We would no longer need this language about the Secretary of Education and a representative of public schools being able to give advice. Okay. Sections 10 and 11 are the two insurance sections, and again, those go back to the way they are now. So we're retaining the link to the CDC instead of recommended immunizations. Section 12 is pharmacists. So this goes back to the way it currently is an existing law with the link to the CDC instead of recommended immunizations. And now one of your instances of amendment was this section 13 that had been reverting pharmacy text to the status quo language, but OPR asked that the language in section 7 be retained as is on an ongoing basis. So that is why this section is deleted, because you no longer need it to revert back to the way it is now. Section 14, this is a repeal on July 1, 2031 of section 2 of the bill, which has all of the language about the scope of the commissioner's recommendations and who the commissioner has to consult with. And then we have our effective dates. That the effective date section, sections 1 through 7, and section 14, this repeal, take effect on passage. Sections 8 through 13 take effect on July 1, 2031.
Thank you. You make it sound so clear. So simple. Okay, committee questions for Katie on this one. I think we've been through it a lot. So my suggestion, I'm open to suggestion. I think we could vote on this first thing Tuesday morning. Would that be appropriate? Yes.
I don't know if this is the proper time of discussion, but
Yeah, no, it is.
there is just one thing I still would like to see in the bill from the testimony that we heard is the risk sheet, if I can call it that, is a federal sheet, and it covers the immunizations that are on the CDC list. And so we may now have some that are not. And so how do people get informed? Should there be a requirement that the state provide a similar sheet for those vaccines that are not on the federal sheet that you would get from the pharmacist or your doctor or what have you? Just so people are aware that it's covered.
So I'm gonna turn your question to the Department of Health.
Yeah, sure.
There, oh, you're there. Lauren Lehman, thank you. Right.
Sure.
And this is gonna be a question that people continue to ask. I think we did answer it previously, but it would be helpful to hear it again.
Lauren Lehman, General Counsel, Department of Health. Since our last conversation, we did go back and look at the vaccine information statements, and there are, even for those vaccines that are not on the federal schedule right now, but are given pretty widely, or might not be given routinely, like dengue fever, or somebody who's traveling, there's a vaccine information statement. And in those, they don't necessarily point to recovered, like, again, the liability statements, but they do give, here are the common repercussions, here's how to report an ad for repercussions, here are the common side effects, here's a list of where to report any adverse events, here's how to, who to contact and when they should contact.
So it's covered.
It is covered. It's not, it doesn't say this is not covered by this.
Right. I was more concerned too about whether or not if it's not on the CDC list, maybe I misinterpreted the testimony, but it sounded like the federal sheet that's handed out just covers those that are on the federal list too. So that's why I wanted to make sure that it covered everything.
Absolutely. And I also want to make clear that, and as we've heard testimony both here and you've heard testimony here and judiciary, that the vaccine information statement is not complete informed consent. So, and it's not supposed to be solely relied on as informed consent. So their healthcare provider is still supposed to go through the foreseeable side effects, et cetera, with the patient in addition to that sheet.
Thank you.
Okay. Anything else?
Two papers on my desk, and I don't know who they came from. Usually, people who have passed things out, there should be a
Should be
an
an name on it.
identification as to where they came from, because I don't know who. And one of them is a signed letter.
I don't know, I don't remember who it was, she couldn't, there you are, do you want to say who you are?
Yes, I'm sorry.
Who you
One of them
represent?
is just the attachment to an email I sent this morning, so I apologize that I forgot to
Okay,
put my
because
name on
normally
it.
with.
Right,
Yeah, there should be a
when you
name on it.
distribute
Right.
anything on the floor, it has to have who it's from, which gives me, I don't know if it's from the Department of Health
right,
or if it's from an advocate or a doctor. It just helps me.
right. So Amy West, Director of Vermont Stands Up.
That would be great. Thank you.
Okay, any other questions for Lauren? Any other questions for Katie or Department of Health? Okay, all right. Thank you. Thanks for that information. So now I think, my suggestion was, to vote on it first thing Tuesday morning. We could vote on it today. We've seen the language previously and we've had an opportunity to think about it. I'm open to either one and I'm looking for a discussion.
I mean, I can make a motion if that's what folks want to do.
So who's gonna play clerk?
Who draws the short straw?
And I will say, I will hold the vote open for Senator Morley for.
He's on.
He's on?
He's here. It's
Oh.
4 a.m., but he's on.
Good morning, Senator Morley.
You awake?
It looks awake.
That's why.
You're still
You're-
muted though.
Yeah, he's,
We're getting. a
And
letter
you're
from-
frozen, frozen and muted.
maybe, oh, there you are.
No, not from. It
You're still muted.
was -2 in my driveway this morning.
She was frozen.
You're still muted, John.
You're still muted.
It's like you may be in a business center. Tell.
We can have them use sign language.
It's the T. You don't have to
One
mute her.
finger
That's.
up is yes, two is no.
That's what.
Or
I was trying to.
up or down, thumb.
Yeah.
Okay.
Maybe.
Can you hear me now?
Yes,
Okay,
terrific. So we're going to vote on H 545 as reviewed by Ledge Council. Or at least we're gonna entertain a motion. Senator Gulick has indicated she's gonna provide a motion. So go ahead,
Yes,
Senator.
I'm happy to do that. I move that we vote favorably on H 545.
Which is draft number.
Draft
2.1.
number
2.1.
1.
And send it.
Send it to the full Senate for.
Oh, so one thing I
For
should
consideration.
say, so there is a motion on the table, but one thing I should say is that judiciary did review the liability section and 5-0 approved that. So they're agree with that. Any other questions, conversation, discussion?
Want me to restate my motion?
Go ahead.
I move that the Senate Health and Welfare Committee vote favorably on draft 2.1 of H 545 and send it to the full Senate for consideration.
Okay, so Mr. Clerk.
All right, take the roll. Senator Benson, yes. Senator Cummings,
Yes.
Senator Gulick,
Yes.
Senator Morley,
yes.
Senator Lang.
No, I'm last.
You are last.
Did you vote?
Yes, first.
Oh, I'm sorry. Did you? Yes, the clerk did a good job. Chair fell apart.
So the tally is 5 yes, 0 no, and 0 abstain.
So thank you, Senator Morley, for your being here. I know it's a challenge where you are, and we really appreciate it.
Well, it's not a challenge after about, well, 7 a.m. It's pretty nice. So I'll be traveling here in a couple days, and I want to thank the committee for allowing me to participate. I participate in every meeting, and I'm trying to keep up with everything. So thank you for allowing me to do this.
That's great. No, it's good. So thank you for that. So we need a reporter. To anyone who would like to report the bills. Okay, I'll report the bill unless there's someone else who can twist my arm and take it away from me. But I'm happy to report it. So it'll be on notice on Tuesday. It'll be up Wednesday. Great. Okay. Thank you. And Katie will chat.
Okay.
All right. So that's it for 5:45. Hallelujah. I mean, it's an H bill and it's taken a bit of time, but I think it's an important bill for us to have worked on. The House was and the Department of Health were very interested in having this work forward. All right. So we're going to move on to the next bill, which is S-142, and Jen is here. From Senator Brennan. Okay. Yeah, can you let Senator Harrison know what we're ready for?
Yeah. Do you know what movie she's on?
Yes, she's on transportation.
Yes, she is.
So we'll wait for her to come in and then we'll go forward. I don't have Jen on here.
Okay.
Yes, I do. Oh. Yeah, it's- Jen,
The fall plants are good.
It smells good.
that's wrong, Bill. 1845.
No,
Maybe we.
We're.
could be, yeah,
Can we?
It's. Go in.
Yeah, please go on.
Yeah.
Yeah.